A Memphis doctor who cares for some of the tiniest patients is working to make sure more babies are born healthy. Dr. Jane Hayden has cared for critically ill newborns for nearly 30 years. She talked to our Alicia Renee about how she's getting to the root of issues that could send newborns to the NICU by making sure moms have a better chance at life.
Inside the NICU at Baptist Women's Hospital in Memphis, some of the tiniest lives fight some very big battles. And every day, Dr. Jane Hayden walks into the NICU ready to help give those struggling patients a chance at survival.
I am a neonatologist, basically taking care of critically ill newborns.
Some are born months too early. Others arrive struggling to breathe, fighting infection, or facing birth defects. But Dr. Hayden says caring for babies starts long before they ever reach a hospital.
Our patients come to us when they're super sick. Where there's poverty, there is disease. We still have difficulty getting access to good prenatal care and transportation.
Dr. Hayden says many NICU cases could be reduced with better access to education, resources, and prenatal care, barriers that shape babies' health before birth, driving her advocacy for women's health beyond the NICU.
I have been a volunteer at the Dorothy Day House. It's a housing for families that are homeless, and the Newville Learning Center here in Memphis, who educates women on getting their GEDs and education and become the head of their households and get out of poverty.
Dr. Hayden says better care for mothers means better outcomes for babies, especially where access is limited. For decades, she's educated families and mentored doctors on breast milk, vitamin K, and vaccines while spending her days on rounds, reviewing x-rays and guiding parents through the unimaginable.
Education is extremely important. We round with the families and the nurses. We include them in the care. We get very close with these families.
And with 30 years in the industry, she says she knew she was purposed for it.
It was a God thing. I get to work with brand new life, and I love it.
Dr. Hayden says even with programs like WIC, TennCare, Obamacare, too many families still struggle to get care. But in Memphis, people always find a way to come together for sick babies.
I wish we had more resources. Healthcare is a right, not a privilege. Babies don't have a choice. Memphis, we're in this all together, and there's no judgment.
For Dr. Hayden, every new life is a reminder hope is still born here every single day. In Memphis, I'm Alicia Renee, and that's how we celebrate Memphis.